If you're a parent, choosing an ABA therapist is one of the most important decisions you'll make for your child. You need to feel confident that their style and personality will be compatible with your child's specific needs. Family members who may be engaging with ABA therapy for the first time may find it difficult to know what to look for and how to assess therapists. We're here to assist parents faced with this challenge by sharing advice on what to look for when choosing an ABA therapist. Today we'll discuss how to find the right autism ABA therapist. Welcome to our channel. We talk about autism with the goal of sharing knowledge and bringing awareness to light. Our goal is to make videos that are easy to understand so many will be able to understand and develop a deeper awareness of autism. With that said, we'll get into it. First, what is an ABA therapist? It's important to note that the term ABA therapist actually refers to two different types of therapists involved in the delivery of ABA therapy. Your child's supervising therapist is called a board-certified behavior analyst. They will write and monitor the treatment plan for your child and supervise the therapist who will deliver it. Behavior technicians or registered behavior technicians work under the supervision of a BCBA. They are responsible for delivering your child's therapy. As you look for a BCBA or BT, RBT for your child, be sure to ask these 5 key questions. Number 1, what is their personality like? It's important to consider a therapist's personality when choosing a therapist, but many people overlook it. Choose someone you feel completely comfortable with, as this will make it easier for you to communicate with them and benefit from their feedback. As your child and you progress through therapy, having a strong relationship with a therapist will give you and your child confidence in the process. Having fun and engaging sessions is key to being a successful therapist. Being patient is also a virtue, as sessions are sometimes long and difficult. In order to assess a therapist's personality, you should have a meeting with one that you are considering so you can learn more about their style and approach. When you feel comfortable with this meeting, you can move forward with a trial period where you can observe how your child interacts with the therapist. If you can't envision that happening, then the therapist isn't a good fit for your child. For therapy to be effective, your child must build a good rapport with the therapist. Number 2, what is their academic and professional background? As well as passing a national certification exam, BCBAs have earned a master's or PhD. Potential therapist master's or doctoral programs should specialize in a field relevant to your child's needs when you are researching them. Ask them about their professional history, such as how many families they've worked with, and what they learned from them. Ask the therapist if he or she has experience working with children of your child's age group, for example. The qualifications of BTs, RBTs vary, since a master's or PhD is not required. When you find a potential BT, RBT, inquire about their qualifications. Ask the same questions about their professional work experience as you would with BCBAs. Number 3, what is their proposed treatment plan? As well as developing treatment plans, the BCBA's approach is of critical importance. It's important that you avoid therapy providers who develop treatment plans that are cookie cutter. A customized and personalized treatment plan will be more effective for your child. It's also important to address the root cause of behavioral problems, not just the behavior itself. In treatment plans, for example, perhaps your child have difficulty starting school every Monday morning. Instead of just treating the behavior, an effective treatment plan would focus on identifying what's triggering the challenge and ways your child can manage it better. Now, before we continue, we'd like to ask for a few moments of your time. If you want to support us and our mission to spread awareness about autism, please leave a like and click on the subscription button. This would help us create more engaging content for you. Now moving back to where we left off. Number 4, how do they approach data? Since ABA therapy is a behavioral science, data collection and analysis are essential for tracking progress and making adjustments to the treatment plan on an ongoing basis. Ask your therapist how they collect data, how they measure progress, and how they report their findings. In order to determine if behavioral goals have been achieved, data is needed, so subjective measures like observing behavior and providing general feedback are insufficient. Specifically, you should ask how a therapist collects and analyzes data. Ask them to show you an example report and explain how they adjust therapy sessions based on the info. Number 5, how do they involve the parents? During the treatment process, be sure to ask the therapist how they involve parents. In order for treatment to be effective, parents and therapists need to work together. With many of the techniques being continued between sessions, find out what type of feedback the BT-RBT will provide you after each session and how they can help you incorporate ABA techniques into your everyday routine. Discuss how you will fit into the bigger picture of the treatment plan and how you will work together to achieve your behavioral goals with the BCBA. Likewise, you should assess whether you and your family can accommodate the therapist's treatment plan and demands it will place on you. If you feel that the plan the therapist proposes could be overwhelming, you should discuss these concerns with the therapist rather than taking on something that might be too much to maintain long term. If the strategy seems to be too overwhelming, your therapist can adjust it to make it manageable. How do you know if your autistic child's therapy is harmful? It's important to note that bad therapy can be abusive and have far-reaching consequences like increased anxiety, depression, and PTSD. We will discuss warning signs of a harmful therapist and what you can look for in your child's therapy plan. Number 1. How does the therapist expect your child to benefit from these sessions? What are you hoping to accomplish? Please keep your child away from them if you want to cure, heal, reduce their autism symptoms, or make them less autistic. Your child deserves to thrive as their autistic selves, to learn how to successfully navigate a world that they aren't built for without compromising their nature. Number 2, what do they practice with your child in therapy? Are they encouraging or forcing increased eye contact? Eye contact can be painful for autistic children and make listening more difficult, as they're using the phrase quiet hands to prevent your child from stimming, which is essential for regulating their emotions and thoughts. Number 3, be wary of the terms they use. Do they listen to your child's pleas to stop when it becomes too much for them? It is called an extinction burst when they're forced to do something they do not feel is right for them. Watch to see if they treat meltdowns gently or just call them tantrums. And their view is that sensory needs need to be addressed rather than respected. If they describe your child's behavior as attention-seeking, consider it a red flag. In addition to planned ignoring, you might also find words like dysfunctional or non-functional in their sales pitch or reports. Number 4, how do they treat your child's concerns? Is pushing your child to achieve results more important to them than preventing sensory overload? Do they understand the need for sensory breaks? Is the way your child chooses to play a problem to them? Watch out for words like inappropriate, used about the way they play, as if playing wasn't just playing. You might also notice that they push your child repeatedly to do things their way without investigating their cognitive level or abilities. They might also insist on speech as being the only acceptable way to communicate. They might also use sweets, treats, or privileges as tools to bribe your child to compliance. If you have these observations, the therapist will not help your child develop. Instead, they could lock them into a cycle of anxiety and self-hatred. Steer clear of therapists who push more therapy hours to address lack of progress. Avoid these who use the gold standard of service and technique. Take your time and do not set arbitrary deadlines for yourself. It's fine to take your time until you find an ABA therapist partnership that works for you. Trust your instincts at the end of the day. You should speak to other therapists if you are uncertain about a therapist's personality, style, or approach to therapy, or if you feel your child will not get along with them. Repeat the process until you found the right therapist for your child. And that's what we have for you today. What are your thoughts? Let us know in the comment section down below. If you want more content related to this topic, make sure to check out our channel. Take care, and we'll see you in the next video.